First, the consent forms, and there are lots of them because this is, after all, a medical procedure. And indeed, Miss Sherina Balaratnam is a qualified and experienced surgeon who now aims to help her clients look the best they can without surgery. One of the first things you notice when you're in Sherina's office is this case study of an actress in her 70s. In the after Juvaderm shot on the right, she looks the same person, but brighter and less tired. That's what we're going for. And while I'm not in my 70s, after 18 years of raising 2 sons, I sometimes feel it. Fillers and other body and face treatments are no longer seen as just for celebs. In fact, many mums I've told about it said they wanted to try it too. And however well you take care of your skin, you can't defy the effects of gravity. Not without some help, that is. And by the way, the good news is that being too skinny isn't such a great idea either.
I totally agree with you. The older that we get, it's good to keep that 5 pounds on, 10 pounds better, because it stays on the face. And when we age, we lose a little bit of facial volume, which is exactly what you're mentioning now, and it shows here. So the main aim for correction actually doesn't start here. It actually starts from what's causing these. If you hold on to the mirror now, so you hold that straight in line, and you can see that what you're not happy here actually starts with here. It actually, in fact, starts with here, because you can see the impact of this area on the temples. Now, this is an area that we often neglect, but you can see the impact on the eye. Curve things up a little bit, then we move down to what we call cheekbone. We look over here, just a little bit there actually raises the profile in the eye and reduces the shadow there, and it actually re-establishes the width to the face, which should be widest from cheekbone to cheekbone and streamlining down into the chin. Does that make sense?
Yeah, because my face looks a lot sort of more heavy.
Two reasons. We start off here, but as a combination of loss of elasticity, which you just mentioned, so skin changing, fat or volume moving, that's what causes the drop in the lower face. So we talked about skin enhancing treatments to stimulate the collagen. That we're not doing today. We're talking then about dermal fillers to restore the volume, not to make you look big or different, but just to address the areas where the volume has just shifted to the cheek. That's a really pivotal point. I don't know if you can see that.
Yeah.
So that's what we're going to do today.
So we need to have a look at what's going on with my skin, or rather just underneath the surface. The Visium machine does just that, measures what's going on 2 millimeters down. Among other measurements, it shows your red areas of inflammation, pore size and sun damage. It compares your skin to other women the same age as you.
So that's where we handle the building blocks in the skin. Collagen, elastin, hyaluronic acid that you spoke about, which is a very water-loving molecule. So hyaluronic acid is what we find in the dermal fillers that we use.
Oh, I was doing so well with the measurements, even scoring 97% for skin texture. But then, a shocker. Sun damage.
We've all got sun damage. So as soon as we're born, we're exposed to a little bit of
I
ultraviolet
used to have
A.
terrible sunburn when I was a kid.
Yes.
Because,
So you have burnt in the past. So if you've burnt in the past, then this is what we're seeing coming up underneath, okay? So you've got a little bit of freckling going on, mainly affecting the cheeks, sides, top of the face.
This damage, remember, is underneath the skin, and I haven't sunbathed since my 20s, but without the care I now take, it could become like this. Oh my God, and that's on the top layer. But it's not just in the sun you need to be careful. Sherina says even if you're inside, mostly as I am, you should use a broad spectrum sunscreen that protects from both UVA and UVB, because the A rays can penetrate glass and go much deeper into the skin, potentially causing skin lesions and texture changes. And one more tip from Sherina: if you want to have really clean skin, ditch the wipes. She believes they don't do a good job.
Okay, and have you noticed your face changing shape?
Back in the treatment room, we now know the true state of my skin, and other than sun damage, it's not bad at all. But what about the wrinkles? Sherina takes the trouble to check my underlying bone structure so she can tell where it all used to be. and how best to put it back. On with the anaesthetic cream. They are needles after all. And then I'm ready for Sherina to plump out some of those lines with the Juvaderm filler. Now, I'm not going to scare you with needles, but if you want to see how you might look, then there is a simulator on the Juvaderm website you can try. So what about me? This was directly before I went in, no makeup. And you can see my features look quite heavy, so you can see the forehead and the nose to mouth lines. Afterwards, first no makeup, and it looks fresher and brighter, exactly as it's supposed to. Not a facelift, just well rested. Only you can decide if fillers are right for you, but my tip would be to be careful where you go and to check credentials. For me, the opportunity was too good to pass up, because being happy with what I see in the mirror makes me feel better. It's as simple as that. And if that makes me vain, I really don't care. Because statistics say that we're living longer, but we're not necessarily living in better health. And self-care can help with that, and for me, this is all part of it. So it's just time to say thanks to Sherina Balaratnam, to S-Thetics, to Allergan, and also to BritMums for the opportunity.